ENT is my subject, ear, nose and throat. And these all three parts are so narrow that my knowledge regarding that is also very narrow as far as homeopathy is concerned. Because I don't know which is a drug for right septum deviation and left septum deviation and right ear abscess and left ear. Very difficult for me to sort of talk on ENT specific, Let me be very clear that approach to ENT is same as what our normal approach is. There is no difference as such. And probably from that angle, your case taking would be same as what we are taking for any other system. In fact, what happened, I was in ICR for in last few years back, and I was trying to make a skin case record, as a specific section, dermatology. No doubt you can make the case record of skin as a separate chief complaint. There you can make all the things, to ask about eruption, to ask about itching, to ask about discharges, discoloration, ulceration, like that. But then when it comes to the selection of remedy, that does not work. So lot of changes I tried to make over there, but ultimately I came to conclusion that there is not much difference in approach to any system with homeopathy. Only thing is, most important thing you have to keep it in mind, and which I always tell my student, you may be knowing all the drugs for ear, nose, throat, whatever respiratory, right from aconite to zincum. You have learned by now, your BHMS already done. All of you are BHMS now. Or DHB, whatever. At least you are 3.5 years course to kiya hai na. Now, these are all common symptoms. What is characteristic? Because whenever any drug you will select, this is common symptom of any coryza. नाक में से पानी आता है, आँख में से पानी बहता है, ये वो. Learn only in acute condition. You must learn any what you call a section, respiratory or anything. You must always go for concomitants. Others common symptoms are there. नाक में से पानी आता है, ये होता है, वो होता है. ठीक है, वो लोग नाक खुजलता है, ये करता है, वो करता है. That is okay. That is part and parcel of intensity of the symptom. But when it comes to selection of remedy, always take care of concomitant. In any system, whether you take diarrhea, whether you take cough cold, whether you take asthma, whether you take headaches, you may be able to describe headache of natrum mure. Okay, fine. लेकिन जब पेशेंट आता है तो तकलीफ होती है ना अपने को. होता है ना. All problem comes when there is a patient. You see, जब तक पेशेंट नहीं है तब तक होम्योपैथिक डॉक्टर बहुत बड़ी बड़ी बातें कर लेता है एकदम. क्या मैंने क्योर किया, ये किया, हो वंडरफुल होम्योपैथी इज दिस. Last week I happened to be chairman of one of the scientific seminar, and the person was given 15 years practitioner was given a topic on use of mother tinctures in homeopathy. A to Z mother tincture एक explain करने लगा. You are there. If you want to really practice homeopathy successfully, homeopathy is simple if you follow simply. If you make it difficult, it will be difficult. And don't make it too easy. वो लेमन के सामने बोलता है ऐसा बड़ी बड़ी बातें नहीं करना, वो भी नहीं करना. It's useless. In fact, I fired him. Public के सामने मैंने फायर कर दिया. ये तुम्हारी वजह से होम्योपैथी के नाम बिगड़ता है. And I am a blunt man. I don't bother for anybody. You see, because they are spoiling homeopathy. For what? इसलिए first of all be very clear. देखो कॉल मेरे को जब ये टॉपिक दिया ना ENT में, बोला मैं क्या बोलूँगा. सब लोग को कोल्ड कोराइजा ज़्यादा से ज़्यादा क्या आता है ENT के अंदर. कैंसर ऑफ, मैं आपको एक केस दिखाऊंगा कैंसर का बड़ा केस, उसमें ये था. फिर किया क्या मैंने पेलिएशन. उसमें मैं कुछ नया तो नहीं करता हूँ ना आपके लिए. ऐसी तो मेरी आदत नहीं है कि मैं एक ऐसी ड्रग बुक में से निकाल के सामने रख दूँ आपके. अमेजिंग क्योर. व्हाट अमेजिंग क्योर? आई टेल यू, at least I am talking of me. I don't know about others. A good homeopathic doctor will not get more than 60% result. The best one. Not more than 60%. You take from me. हाँ, कफ कोल्ड कोराइजा में कोई बोलता है 100%, तो वो तो ठीक है, वो ऐसे भी 7 दिन और वैसे भी 7 दिन, तो कुछ फर्क नहीं पड़ता है. हाँ, तो वो 100% तुम बोल सकते हो. बट ओवरऑल प्रैक्टिस के अंदर आई डोंट थिंक एनी. आज तेंदुलकर नंबर 1 है, कितना एवरेज है? 50. हाँ, स्टिल ही इज नंबर 1. 50 से ज़्यादा किसी का हो ही नहीं सकता. इट्स अ नेचुरल कोर्स. यू सी, यू कैन नॉट बी 100%. इवन डॉन ब्रैडमैन भाई नहीं था. So what I am trying, be very practical, be on ground, remain with the what you call as your organ on and material. That's all. To practice simply, you will get better result. I can assure you. Or acute में wonderful. But my first thing to you, all of you, is कि भाई, today one of my assistant who is coming to me, she is also practicing the last 15 years, and she came out with a very simple question to me. Sir, one case. Now I am coming to you. I am asking you the same question of the patient, which is posed to me, related with coryza, cold, upper respiratory infection, which is our topic. She says a child of 6 years was there. He has got cough and cold and coryza, and he has got watering of the eyes. He has got nasal discharge, and then they are not able to tell me whether it is acrid or this or that. No fever, nothing. And every time change of weather gives this problem, and nothing else, only this much. The itching is there? No, nothing. This is the only symptom. Mother does not know anything about more than this. Appetite, stool, urine में ज़्यादा कुछ मिलता नहीं है. बच्चा था, कभी ये खाता है, कभी वो खाता है. डिलेड माइलस्टोन नहीं था, कुछ नहीं था, नथिंग. अभी इतना ही सिम्टम मिला, आप क्या करेंगे? ओनली दिस मच सिम्टम. चाइल्ड कैसा है? हाँ, वो प्लेफुल है, ही गोज विथ एवरीबडी, ही इज एंजॉइंग. और क्या बताएगा? मदर कुछ बताती नहीं. और क्या है? बच्चा, हाँ, डांटा तो कभी रो पड़ता है, कभी नहीं रोता है. बहुत ज़्यादा गुस्सा किया उसके पर तो वो बाहर चला जाता है. दिस इज द प्रैक्टिस. माइंड वेल प्रैक्टिस इज दिस. प्रैक्टिस इज नॉट एलियम सिपा, यू गिव सिम्टम एंड पेशेंट इज, यू गेट द पेशेंट. नॉट दैट. ऐसे आपके सामने एलियम सिपा होगा तब भी नहीं पता चलेगा ये एलियम सिपा है. और दिया तो ड्रग नहीं काम करता तो भी सोचने का क्या करने का. And when you give Helium Cipa and the patient is not better and he goes, the cough cold goes down, that means your drug was wrong. Keep that in mind. But patient will tell, डॉक्टर वो डोज दिया ना आपने, मेरा छींक बीक सब चला गया. हाँ, वो तो अभी सब अच्छा, अभी थोड़ा खांसी होता है मेरे को, ड्राई कफ. रॉन्ग ड्रग. ही इज हैप्पी, बट यू मस्ट अंडरस्टैंड कि तुमने कुछ गोची किया है, अंदर गया है. सो दीज आर द इम्पॉर्टेंट पॉइंट्स कि एक्यूट को हैंडल करना है या क्रॉनिक दवाई दे. तो मैं ये बच्चे के बारे में बोलता था, तो वो बोलती है अभी सर मैं कौन सी दवाई दूँ. तो मैंने बोला नहीं ठीक है, मैंने उसको रस्टॉक्स दिया. मैंने क्यों दिया उसको? नहीं, वो डैम्प वेदर थी, वो गीला हो जाता है, तो हो सकता है अभी वेदर भी ऐसा है. बोला ये तुम्हारा एजम्पशन है ना. डैम्प, बिकॉज कुछ नहीं मिला तो तुम कुछ भी इमेजिन करके लगाते हो ड्रग. आर यू गेटिंग अ पॉइंट? Maybe this, maybe that, but that doesn't work in homeopathy. You have to be very exact, very precise in your selection of remedy. And acutes are there which you will be able to do it very clearly. But to give acute drug in acute condition or not, or to give constitutional drug in acute condition is the problem in patient. You take from me a simple case of rheumatoid arthritis, pain in joints and stiffness is there and patient is better by warm and aggravated by first motion, second. You are bound to give Rustox but doesn't work. Or Sabadilla like symptom, everything is going out and out and out and patient is very weak and this. कभी भी किसी ने वो Sabadilla का symptom बोला है कि मेरा फेस मुझे ऐसा दिखता है कांच के अंदर? वो बुक में है. Distorted face, as if my face is distorted. प्रैक्टिस में कम मिलता है. मिलता होगा किसी को डिस्टोर्टेड फेस ऐसा होगा, ऐसा नहीं कि नहीं मिलता है कि मुझे ऐसा लगता है मेरा मुंह ऐसा टेढ़ा मेढ़ा हो गया है. ओके, लेकिन टू गिव सबडीला एट दैट टाइम और क्रॉनिक ऑफ सबडीला इन एक्यूट कंडीशन, दिस इज मैनेजमेंट एंड दिस यू हैव टू लर्न. I want to teach you that rather than teaching you all the symptoms of all drugs which you know, which anybody can read. Selection of remedy is not important, but when to give medicine and how to give, that is important. You see, so please try to learn these things from practice. Rather, enough materia medica you know, so I don't want to go into it. Now I will tell you. I have got this particular chart. This chart is enough for you to keep before you for practice, mind well, not to learn materia medica. And if you get cold coryza like this patient, see all the concomitants. If any one of these is present, is the drug. Otherwise, in most of the cases, you will find same thing.